Thanks for being here. My name is Joe Glaviano. I'm the program manager with Aurora Health Alliance. This is our fall quarterly community meeting. Thank you for being here. So Haley, you are welcome to come up here if you'd like.
Hi, I'm Haley Foster. I'm with Aurora Partners for Thriving Youth. I also work for Aurora Public Schools. Aurora Partners is a community-led organization, our community-led coalition that works on substance prevention here in the city of Aurora. Our mission is to partner with youth in the Aurora communities to create opportunities and empower youth to be leaders and thrive by embracing social, emotional, and physical wellness. Okay, so the coalition started in 2016 through the Aurora Youth Options and under Aurora Mental Health. During that time, and that was it was formed to address substance misuse in Aurora. So during that time, they partnered with APS School District to do some life skills training for the kiddos, and they also did a pro-social norming campaign that worked on just kind of changing the perspective of who's using and how often they're using, that kind of thing. In 2018, Tri-County Health Department took over the facilitation of Aurora Partners, and then they looked for funding to sustain it. So in 2020, we received the Drug-Free Communities Grant from the CDC, and during that time, over the past several years, we focused on building partnerships, collecting data, and designing strategies that make a difference within the community. Looking ahead, we're really entering in a new phase with a focus on advancing policy and system changes, and then strengthening our school-based supports. And then we also want to create opportunities for students and the community to develop and implement initiatives throughout the community. So AP Aurora Partners uses the strategic prevention framework to really guide our work. The framework is really similar and mimics closely the public health approach to community level change. As a group, we closely look at data and from local and Healthy Kids Colorado to approach prevention by understanding the risk and protective factors that are available are present in the community. As you know, risk factors are those conditions that lead to substance use, like easy access that we'll talk about in a little bit, and peer pressure, those kind of things. And then, but Aurora Partners really likes to focus and elevate those protective factors in the community. Those are the ones that mitigate some of those risks. So we focus all our work on the 4 domains that would be the school, community, family, and an individual. And when we believe that when we strengthen protective factors in each of these areas, we create an environment where youth are more likely to choose healthy choices than the bad ones, right? All right. So we work through collaboration with our community partners, and we do this a lot by we want to really involve youth. So we have some student coalitions. We have our youth doing advocacy work, which we'll talk about a little bit later with the TRL. We have them doing activities with younger students to teach education and prevention for them. The partnership with APS has been it's been a real blessing for Aurora Partners and for our students for all the work that we can do with them. We're also providing information to parents during their back to school nights, during parent-teacher conferences, where the students really want to do some work at football games and basketball games where people are actually coming and we can get people in front of and talk to them about it. We also, with some great partners, especially with the health department, we provide education, intervention, and cessation resources to the schools that will help with, we're trying to reduce suspensions and at least provide some alternatives to suspensions for the schools to use, and that's been a pretty good partnership that we've had with them. We're already seeing some great impact that Aurora Partners having. We are shifting the perception of harm. We are improving the communications between family and the schools. We're influencing policies that create safer neighborhoods. All right, so this is kind of what we're here to talk about. When we were developing our strategic plan about 18 months ago, we came across some alarming and some kind of concerning information regarding access to nicotine and other products. So about 50% of our kids in the city of Aurora say it's easy to get vape pens and nicotine products. The most alarming is the trend here where since 2019, we have been seeing that kids are not being refused due to age when they're trying to purchase tobacco and nicotine products. It's an alarming 84%, and when we factor in Aurora, Arapahoe County and Adams County, that goes up to 85%. When we factor in where they're getting it at, like gas stations and other retail outlets, about 24% are getting them just going into our gas stations, our vape shops, and buying them. There was a report at one of our high schools where kids came in and said, yeah, they sold us vape pens. They didn't even ask for ID, and those were the two closest retail outlets to a high school. We were also, when we were looking at this, we saw a disturbing trend in density. So if you look at this, these numbers here, 101 tobacco retailers are within just 100 feet of schools. That means that these kids are walking past vape stores and stores that sell these products every day on their way to school, wherever. And we know that that this kind of exposure normalizes these products and increases the likelihood of use. We also know that 30 stores are within 500 feet of a school. What is that, like maybe a 3-minute walk? And 8% of the retailers in Aurora have been caught selling to minors. Now, 8% doesn't seem like a lot, but they're only doing maybe two compliance checks through the state per year to 354 tobacco retailers here in Aurora. So are all of them being, we don't know. So that is some of the other kind of concerning information we have. We also know that 23 campuses in this district have 3 or more stores within a half mile of their schools. That's 3 stores in every direction where kids can buy vape products, and we know that they're not being refused. Finally, one of the most telling statistics that we have is the zip code 810 has more vape stores than they have grocery stores. What does that tell us about, kind of our priorities here in Aurora? Our research showed that there are also some products that are being sold at tobacco retail outlets that are so it's important to know that vape and smoke shops are not just selling nicotine products. Many vape stores and smoke shops are selling a wide range of psychoactive and mood-altering substances. Some legal, some regulatory iffy kind of things going on with them because they're new. Things like kratom, things like OH7, which they call gas station heroin. They are selling nitrous oxide in vape stores. Does anybody know why you need stuff that make whipped cream at a vape store? No, it's Whippets. Does anyone remember Whippets back in the day? They're selling big canisters of Whippets in the vape stores, and we know they're not being refused due to age, right? So, so that's what. All this information led us to kind of look at what we can do, and what the coalition decided is that we would try to get the city of Aurora to do a tobacco retail license. And so what that is, it's a local license. So we do know the state has one. It's a local license that requires businesses to sell legally sell tobacco and nicotine products. So we want more compliance checks. So we're asking the city to do a couple extra compliance checks during the year. We also, this is not a tool to, we're not trying to We're not trying to we're not trying to be bad guys to the retailers. We're just asking them not to sell to kids. That's the only thing we're asking them. We really are not picky about it. We just don't want them to be selling it to kids, right? That's our whole thing. So we also want to make sure that we're also regulating some of those things that aren't yet regulated, or at least monitoring the compliance of those stores selling this stuff to our kids. Because there's an emerging trend with these other products, these synthetic opioids and synthetic cannabinoid things that they're selling in the vape shops. Okay, so that's pretty much it. If you guys want to help, we really are looking for a lot of community organizations, people that live in Aurora, to really reach out to our your city council members. A lot of them are already on board with us, but we want to make sure that we get everyone on board. Let's bring the Aurora City Council together over this over this ordinance. You can call them, you can make public comment. We've been making public comment every Monday since maybe the beginning of September. We have a bunch of kids that are doing it. So it's really is a kind of a group effort. And then you can join us. We meet every Tuesday or every Wednesday. If you want to reach out to me, I can get you the invite. And then also if you want to join the coalition, because the coalition is really the bottom, kind of the driving force behind this work. And we really want community members to come together and help us, with this work, and then with other things that we need to address within the city of Aurora. All right, that is my presentation. So thank you. If you have questions, we're doing questions now, after? Now. Okay, anybody have any questions? Okay.
Unless I missed it, I didn't hear you say what age is this.
I'm sorry, what age? 21. All these products are regulated that they only 21 or older can buy them.
So the people that you are working with are not under 21?
No, the kids, the Healthy Kids Colorado survey is high school and middle school students reporting. Yeah, and I think these are just high school data, and those are the ones that are saying that they're buying that they're not being refused due to their age, wherever they're buying it at. They could be buying it anywhere. We have a lot of anecdotal information from kids that I work with, and they're saying that the kids in the high schools are going into the middle schools and selling vape pens to the middle schools. That's how our 8th, and we've had 5th graders vaping, 4th graders. So it's really kind of an epidemic. And big tobacco wants kids to be addicted. They know 80 to 90% of people, adults that are using nicotine products today, started when they were adolescents. Big tobacco knows that.
Are you working with the Cancer Society Cancer Action Network?
No, I don't think so. I have to give all the shout outs and all the work that's going on at to Adams County and Casey at Adams County Public Health. She's the one that's chairing this for Aurora Partners, so she's been doing a lot of the work, but she might have been
replicated across the state.
A lot of organizations or communities do have a tobacco retail license. Cities, Aurora just doesn't. So that's one way we thought we could actually make a difference with providing that. Yep.
Compliance checks conducted, you send kids in?
Yep. The city of Aurora, a gentleman named Trevor Vaughn, who works with us a lot on this, and it has been he's the one writing the ordinance for us and doing a lot of work with that. He does employ some operatives, they call it, who they take into liquor stores and these kind of stores and check compliance. And he's also been really great on pulling some of these tobacco product or nicotine or THC products that are in vape stores that are selling off the shelves for them too, because a lot of vape stores are selling THC.
Can I ask what the pushback is behind an idea like this? Is it mostly about funding for those compliance checks and concerns there, or is there any kind of common threads to where there might be some resistance?
To be honest, we haven't really seen a lot of pushback about this, but if it is about the retail we're proposing is a $500 a year license. What it is supposed to do is just pay for those operatives and pay for the people who are doing these compliance checks and stuff like that. So that's kind of what we're going at. We really haven't had much opposition to it. I don't know, I know Leslie's on the line here. She's a big part of this, too, if she can think of any other opposition other than maybe the $500, but we know retail tobacco, outlets are making about $18,000 a month, so $500 is not anything. And we do want to find them if they are, we want to put some of those in place if they want to, if they're continuing to sell to youth, we want to make sure they're held accountable to that.
You know what department Trevor is in?
He's the manager of licensing, so he does all the tobacco, all the alcohol, all the
Once you like learn a little bit
THC.
about the infrastructure or like the organization of a city or a municipality, the less you know, I feel like, so cool.
He's a great guy, been really instrumental in helping us with this, so.
How much is the fine? Is it enough of a deterrent to keep them from selling kids?
I don't know if it's, I don't know. I don't remember what the, it's not that much, right? It's not gonna break the bank. It's just, again, to hold them accountable to who they're selling them. We have, we're trying to do a big push with the retailers, trying to educate them on this, letting them know that, they need to support our youth and that we're behind them supporting our youth, so.
To that question too, I wonder, are there other cities or municipalities where they have, 3 strikes, you're out, or like?
Yeah, that is definitely, I think, in the plan. Yeah, if they continue to violate it, yes, they will lose their license to sell tobacco. That's the same with the state too. If they violate it through the state and continue, they could lose their license, or, sometimes they're not allowed to sell for 7 days or something like that, so.
Thank you.
So Anita and Jazmin are next. I know Anita, I think is online. Hi, Jazmin.
Yes,
Thanks.
I'm online. So hi everyone, my name is Anita Bancroft. I am the manager of the Community Nutrition Programs team over at the CU Anschutz Health and Wellness Center. Today I'm presenting with Jazmin, who is in person. So how this is going to go, I'm going to kind of talk a little bit about the front half of our presentation, which is really going to kind of focus on like campus and some other areas. And then Jazmin will finish off with really discussing things that we do as far as community. So really our main goal on our team is to improve health and well-being through culturally relevant research-based nutrition and culinary education. So a little bit about our team. We're a small team of 5. We consist mostly of part-time employees. We do have 1 full-time person on our team in addition to myself. I'm also full-time. The rest are part-time. And we are all registered dietitians and culinary educators. A few of us have had some traditional culinary training background, including myself and Jazmin. And then a few of us have also have some public health background, so a solid foundation in public health through our graduate studies. And that is also including myself and Jazmin as well. And then Jazmin is actually our only dietitian on the team who speaks Spanish. So we're so lucky to have her. She's able to teach and speak Spanish to our participants for our community classes. And you can go to the next slide, please. All right, so this slide is really just kind of to help us understand a little bit of the different areas that our team focuses on. Like I said, I'm really going to focus more on like kind of the campus wide stuff that we do. And so really that Anschutz Medical Campus, and then some of the additional commitments that we have. So most of the things that we do are really focused on nutrition education sessions, cooking classes, and cooking demonstrations. We do have cooking classes for employees and students on our campus. For our cooking classes for employees, those are mostly going to be like team building events for different departments and different groups. And then we also have student cooking classes, and those are going to be more so kind of ongoing classes that we have support through the chancellor. So they're actually free for our students. A couple of those are called CU Eat Well and Lab Collab. We also focus, or we have a partnership with Marcus Institute for Brain Health, or it's also known as MIBH. They're also located on our campus, and they really focus on programming for those with traumatic brain injuries. And our group is able to do some nutrition education sessions for those groups. Those really consist of mostly first responders and veterans. And then another area that our team is more expanding into is a program called Health Meets Food. This is a cooking class / nutrition education course for our medical students within the School of Medicine on campus. We currently have in-person offerings for them, and we are expanding into a virtual elective option for them coming in the spring. So we're really excited that we get to be a part of that as well. And then we also do other cooking classes and some other nutrition presentations for other academic courses on campus for the different schools, like the School of Dental Medicine, some other electives for School of Medicine, and then some pharmacy and things like that. And then just a lot of various other partners on campus. We just have a lot of people that reach out for different cooking classes or presentations. And then some of the additional commitments that we have, well-being programs is kind of one of the building-wide things that we do. We have really a small part of that is really, again, nutrition education or a cooking demonstration. So it's like a group will come to our center and they'll come to us for one of those things, and then they'll get sent off to, say, a yoga session or a mindfulness session, and it's kind of like a small like mini retreat, essentially, is kind of what that would be. And then we do have some hand in research. There's various research studies that happen in our building. And the two that we currently are involved in are called Be Fed, Be Well and Time to Be Well. And really our part of those research studies are, again, that cooking demonstration piece. Some of the other things that we get to do, we are preceptors to dietetic interns. So to become a registered dietitian, you have to go through a dietetic internship, and we get to be preceptors to some of those students. And then we do things like new student information fairs, and then we do create the recipes for the CU Anschutz Health and Wellness Center newsletter, and then also the CU Medicine newsletter. So if you get either one of those recipes in there come from our team. And then some additional resources for the Anschutz Food Pantry on campus as well. So that's a little bit about kind of the campus side of things, and I will hand it over to Jazmin to kind of focus on the community.
Oh, that works? Okay, I can figure out computers. Hey. My name is Valencia. I'm a registered dietitian. I also have an associate degree in culinary arts. And so I was just hired in November to start start helping build classes for the Spanish speaking community of area codes 10, 11, and 12 here in Aurora. And this is a relatively new focus for us to put a little bit more emphasis on the community and what we can do to help the community. So currently we have launched what we call our CU Anschutz Health and Wellness Center cooking series. And so we actually have 3 different classes. We have Healthy Eating on a Budget, and then Comer Sano con un Presupuesto, which is the Spanish version of that, but they're not completely the same. There are some differences in the classes. And then we also have Cooking for Healthy Aging. And these 3 classes are free classes to the community, all 3 of them. They're going to be they're a series of classes. So Healthy Eating on a Budget is a 6-class series right now. I think in the winter, we're switching to a 5-class series. Comer Sano con un Presupuesto is a in-person 6-class series currently, and in the winter we are switching to Zoom. And then Cooking for Healthy Aging is also on Zoom, and it is offered quarterly. And we're planning on doing these pretty routinely. We are doing the best we can to outreach for these things, because sometimes it's just challenging to get people to commit to something that's free. So I've been attending community meetings. I've been trying to network with other organizations that might touch the population that we're trying to reach. And not that it's exclusive to these populations that we're trying to reach. Really, anybody can attend for the most part. But we're really trying to, make an improvement in those populations as well. So all of these are free to attend. Zoom only has a limit of what Zoom limits, right? So currently we can have 100 people on Zoom. And then after that, we can switch to a webinar version, and then there's a little bit less interaction with the teacher and the class. So in addition to that, we're open to doing other types of events as well. In order to help with the outreach, I'm in December going to do a presentation at Amigo de Mexico, who has been one of my biggest outreach methods for my classes, to sort of lead them into the winter series that's going to come up. And also other types of presentations. Amigos Mexico, invited us to help them or to set up a table at their back to school event. And so really just reaching out to any way that we can to sort of get the word out that we now want, you know, we're now focusing on the community. We now want to do more for the community. And then any other type of organization that might be interested in that as well. So we're here trying to build those relationships. I've been attending pretty much all or most of the community meetings that are out there in order to build those networks. So currently, you know, all of our information goes out to Amigos de Mexico. They distribute it. We're a wellness community. We make of the Rockies, and really we got quite a long list of people that we're sending our information to and trying to get the information out. Some other things that we're working on. Last year, I think might have been the first year that we put a rooftop garden. There's been the rooftop greenery, yeah, at our building. And so last year they started doing a garden. And with the produce that it was a little bit late in the season, so they would have quite a large distribution. We had Adam, one of our other dietitians, distribute the produce to the Dawn community. So we just set up shop and just try to get people to take the produce. And so this year I've been working with, in conjunction with the food pantry on campus, and then Amigos de Mexico, who has their food pantry, their food bank, twice a month, trying to distribute the produce that were reproduced to those areas. And we're continually learning on this garden, and so next year it'll probably look even different, and hopefully we'll have, you know, a good perception of how much produce we're getting, and how well things grow, kind of figuring out what actually grows on the rooftop. We're working on improving our website. We've added a Spanish page to our website to help sort of inform the public that, you know, here are the classes, here are upcoming classes, other resources. There's some recipes on the bottom. We're also working on developing like YouTube channel and snippets and little informational cooking tips or kitchen skills videos, anything that we can do, and then recipe cards, just trying to develop things that we can hand out to people, really, right? Give them some new things to cook that might be a little bit more balanced. And then you saw the garden. Here's a little tour of our building. So at the top corner, we have our, well, it would be left corner. We have our cooking demonstration area. So my current class, in-person class, is currently held in that area. And I cook, and then everybody can listen. I hand out little samples. We have our grocery lab, which is kind of like, I guess, a sort of post-cooking class seating area. Because these bottom two are our kitchen, and in our kitchen we have several stations, so that when we do have in-person cooking classes, we can put people into groups. And then, you know, people go into the grocery lab and either eat or with the med student class, and they discuss their coursework also. So we just wanted to kind of put that in there a little bit. But yeah, this is pretty much what we're doing right now, what we're trying to build, we're trying to make an impact. And so I do have flyers all the way in the back, and I have other information if anybody is curious. So any questions?
What do you find makes a bigger difference, the knowledge or access to healthy food in your experience?
So because so I have the healthy eating on a budget, and then I have comer sano con un presupuesto, which is the same concept. The recipes that I specifically am developing and presenting in these classes, and also Adam in the healthy eating on a budget, we are emphasizing on low cost items that have a balance. So as much as, you know, as there are food access issues, we are concentrating on the most cheapest items. I am trying to make sure that most of the meals that I'm creating are actually like less than $2 a serving or less, right? Yes, exactly, right? Trying to be innovative with products, utilizing, you know, which is kind of interesting because, you know, the cheapest products, but some of those cheap products are really quite nutritious, such as beans and whole grains and whatnot, and they store really nicely. So, so as much as we're not making an impact on that access as much, we're trying to make an impact at least on like, well, this is what you have, this is what we can do.
And I only ask that because I know, you know, the zip codes 10, 11, 12, that Walmart closed, that the Walgreens closed and there's not a grocery store anymore. So that, I was wondering if you had solutions for people who live the zip code.
So we're working on most of the recipes that I try to work with are going to be super cheap and utilizing a lot of beans and grains and things.
And what is the border? With my raising my hand.
Is there a question back there?
Are you willing to go to a community-based organization to provide a class so that people attending are already comfortable with?
So that's what I'm doing in December. I'm going to be holding an event at Amigos de Mexico.
Okay.
Because of the familiarity. One of the things that I'm feeling with my class is getting people into the building.
Yeah.
It's unfamiliar, it's foreign, it's big, it's confusing, there's a current fear due to the political climate and all that sort of stuff. So I'm actually gonna go to Amigos de Mexico, which absolutely, completely willing to go somewhere. Although actual cooking demonstrations are probably not gonna happen, but at least, an informational presentation.
I'm curious about this Health and Wellness Center just more broadly. I don't know if you share a little bit, because it's relatively new, right? The center itself.
I don't know, Anita?
No, so the center's been around for quite a while. I'm trying to think back when it was first started. I know it's been there since at least 2019, and maybe before that. So it's not necessarily new on campus. I don't think a lot of people are aware that we're on campus, and so we're trying to also. That is one of our goals as a center, is to try to kind of increase awareness, and so that could be that we're just not really known on campus. But the building was built. I've been there at least 4 years, so it's been there at least, I think, 5 or 6 years, probably longer than that. I would have to look for sure, but.
Have you thought about going into the school?
So we do some work with, so we have had AST is not too far from us and they're coming into us. But as far as going into the schools, most of these classes that we have are actually more for adult populations. But I have thought about trying to access the parents through the schools. But I don't think we have any direct things right now that we've done.
Yeah, because I was thinking about the parents, could they have coffee time at the school and everything, they can do a presentation to them. Or even also in the evening, or I can connect you with some of this.
I would appreciate that.
Me too.
Is it back there?
On little Molly Hagan, has her hand up. Molly, do you want to come on?
Hey, yeah. I work at the infectious disease clinic at UC Health and UMed, and I'm wondering if you guys ever work with any of the clinics on campus, because this definitely wasn't something that I was aware of, and a lot of our patients experience food insecurity.
Yeah, so I have actually just did a class with the UC Health transplant team. And then they have another one that I will do next month as well. And then the Latino task force is it's also a on campus sort of thing, which they have a big thing coming up next month that I will be doing 3 back-to-back cooking demonstrations for.
Cool. Okay, great. Yeah, we're on the same floor as the transplant team. So I will definitely reach out to you after the meeting. Thank you.
Yeah, thank you.
Are you familiar with Cooking Matters?
Yes.
Yeah. Okay, so because they only work with kiddos, like parents of kids, and then you're targeting the adults. I'm wondering, have you reached out to the clinics and to the community orgs who are doing the diabetes prevention programs or the heart health programs? Because they already have established groups, and that might be easy to pair the cooking class with those groups, because they're doing the diabetes prevention or even diabetes, kind of how to control your diabetes. That would be a great partnership to help people understand how their choices on food really impact their health in that way.
I have not, yeah, I have seen it. I think one of the first things that I did was, I think it was one of the things that actually brought me to Amigos de Mexico is because they hosted I think a Cooking Matters class or something like that. And so I reached out to them first, and so that a lot of my communication so far has been with them, in that, because they've been so, big in helping to distribute the information.
All right. Thanks, everybody, for having us. Come on up, Lauren. I'm Erica Pike again with Children's Government Affairs team, and we were asked to come talk a little bit about civic engagement and advocacy and why it's important, in addition to all the other many things that are competing for your time and attention. I've heard a lot already today about how many of you, at least with the presenters, are advocating for healthy food, healthy air, and healthy access to for a lifetime of lifetime free of addiction. So there's a lot of work and experience in the room. So we hope to just share a little bit more about why we think it's important to advocate, why you all can get involved in some of the work that we're doing, and hopefully answer some questions as you have them. So why advocate? Why is Children's Hospital here talking about advocacy? Advocacy is actually a core part of our mission. So we care about children's health. We're access to research and also advocating for whole child health. We know that decisions of policymakers are we are at the mercy oftentimes of decisions from policymakers. And both here in Colorado, locally with some of the local work that you're doing at the city council level, and also nationally. So our team, we provide advocacy and government relations work for the hospital to make sure that kids' voices are at the table when these decisions are being made. And really, another thing that we want to share today is a lot of us know the social determinants of health, access to food, housing, education, etc. Actually, civic participation is also a social determinant of health. There's studies from countries, 44 countries around the world, who participated in the study, and those who were involved in civic participation, like voting, volunteering, and getting involved in the electoral process, whether that's campaign activities or registering people to vote, they had better reported health outcomes than those who were not. So if you need another reason to vote, that's one. So do you want to kind of tag team this? Sure. Okay. Yeah.
So we always like to level set too on what advocacy is. I think a lot of times when we do advocacy trainings, everyone thinks about going to the State House or going to Congress and doing that type of testimony, but really the core of advocacy is storytelling and knowing all organizations that you work with, knowing the populations you work with, even the presentations that went before us. You all are connected to so many really powerful stories, and I think it's really our professional obligation as folks that work in that middle space to be connecting stories to the people that are in positions of power. So when we talk about advocacy of children's, we really say that it's storytelling to impact change and build support for the causes and policies that you care about. And again, the experiences that you all have and the ones that you're seeing in the communities you're working in are really powerful and need to have a seat at the table, because policy is going to happen whether those voices are at the table or not. So we really want to make sure we're building those spaces when we can. And again, it does not mean that you have to go to the State House and do testimony there. We'll talk a little bit about some of the different ways that we do advocacy work, but I think especially now when we're seeing health and public health is such a central rhetorical argument that we're all going through, and it's coming up in the news all the time. I'm sure if your family is like mine, you're talking about it around the dinner table all the time. So again, with all of you working in this space and the communities that you're connected to, a lot of advocacy right now is really about those conversations that you're having day to day and how you can be advocating for public health. We really think of it obviously through a child health lens, but no matter what the specific subpopulations you're working with or issue areas that you're working on, whatever it is, I think knowing that you can be a powerful advocate by just having those conversations and continuing to show up in community spaces, continuing to advocate and continuing to share about the things that you know about, no matter what space you're in, I think is a really important way that we can all be doing that type of advocacy work. Anything you would add to this slide?
Maybe just a question, raise of hands for in the room, and maybe I can jump over to the Zoom to see raise of hands on Zoom. Is advocacy a part of your work? Okay, I see most folks in the room. Let's see online. Yep, okay. So that's great. So you all may have things to add and share kind of what advocacy looks like in your roles, and we can maybe spend a bit of the dialogue doing that. All right, so coming back to the slides here. How are we speaking up for kids? We are doing those meetings with legislators, and also this is also an invitation for you all to join us too. We're doing internal feedback, so we're reaching out, doing stakeholder engagement. This is an issue that's coming up at the State House or on Capitol Hill in DC. We often get involved in local issues as well, like the Denver tobacco or flavored nicotine ban, things like that. So we are getting involved on local level, but checking in with various stakeholders. Is this going to affect this community in a negative way? How are we improving legislation beyond just what was initiated? Doing tours, so a way to raise awareness about children's and the way that we provide excellent care to kids in Colorado and beyond our 7th State region.
Which I would add too, if you aren't doing this, this is such a great thing to add on, especially right now when they're, for your state policymakers that are out of session. Now is when they will say yes to that versus January through May. And we see so much fruit of having policymakers come to our space, meet with our experts, meet with some of our patient families. And again, you all are in spaces where you're connected to some really powerful stories. So if you're not inviting policymakers in, and it can be those state level folks, but certainly local level folks, and with an election coming up and a lot of new folks about to come into office too, using that as an opportunity to invite them into your spaces rather than always going to them. We go to them a lot, but I think it's equally important to have them come to you, see your space, really have that strong visual connected to strong stories about what your organizations do and what your communities look like, sound like, what they care about is helpful for them to carry into policymaking.
Yeah, I was just at an event at the Aurora Mental Health Center that they hosted a roundtable for Attorney General Weiser and the Aurora state delegation. So Rep. Carter was there, Rep. Niquetta Ricks. So there was, and I think Eliza Hamrick. So, and they were all just taking furious notes, like what's going on? How can we help following the major federal changes to Medicaid? And how our state is in a budget deficit. You know, they really were looking for ideas and wanting to hear directly from providers. So having those invitations is really a good idea. Let's see what else. Media engagement. So there's no shortage of really good reporters here in Colorado, looking to make sure that they're elevating the stories of interest to community and also related to things that are happening at the Capitol or in DC. What else would you add to this slide?
Social media, we all love it, we all hate it, but it still is relevant to the policymaking conversation. So continuing to work in that space. And something, this is actually a postcard that we hand out to folks that take advocacy trainings. Whenever any of Dr. Ruman's residents come to a training, they get a postcard like this. So we really just use it to start getting folks' minds running about what are your interest areas and what's your skill set, and finding that nexus between the two of those is where you will be the most powerful advocate. If you don't want to public speak, you don't have to testify. You can find different avenues that really work for your skill set. And again, because you work with these larger communities, you also are in a position to do that organizing for issues with those that you're working with and encouraging them to do the same, to really narrow down what issues do they care about, what issues does their personal experience speak to that they can really put a face with an issue, and what's their skill set. Good for that slide.
So on this page, is this on the website and then you would click?
We have a semi-similar form. It's not quite as well developed as our postcard is. For some reason, we love the hard copy postcard over a more agile webpage,
So if
but
someone's like interested, you would say, count me in and check, and.
Mhm. yeah, and I'll share too at the end, we have a general advocacy inbox at Children's. It's just advocacy@childrenscolorado.org. Those technically go to me, but it is a big inbox. So if you ever are interested in partnering with us, if there's a local issue that you want to elevate, if there's anything that we can do to be a partner too, we obviously are not acting alone in the advocacy work that we do. We do everything in coalition, everything with others. So always feel free to reach out to that advocacy inbox, and then we can do the work of navigating you to the right internal person or internal team too.
Do you all have 3 primary issues of concern in the arena of children and their healthcare? Are there 3 areas for which you focus on specifically?
There's slightly more. That's a great question though. So the way that we could have started there as well, but the way that we determine our policy priorities at Children's, we have a community health needs assessment that we do every 3 years. One for the Denver metro area and then one down in the Springs, since those are where our 2 largest kind of hubs of our hospital system are. And those really are asking as many people in as many ways, what are the health priorities for your community? What are you seeing pop up? So it has changed over time with each of those assessments. Then we go through a process of what implementation for those assessments would look like, and we determine policies from there. So we have bigger buckets. I'm thinking about the one in 2024 we're implementing now. So some of the things that popped up in there were preventative care, mother and infant policies, access to care.
Injury prevention, access to care, injury prevention, mental health, and preventive.
So we use that kind of as the umbrella for our policy work, but then overlay that with what are the politics, where are the policy opportunities, where can we step into those spaces, but really try to stay as aligned with what we're hearing from communities too, because obviously a lot comes up related to child health policy. We want to make sure we're reflecting the communities that we're serving.
And an example of that, to kind of bring it from the needs assessment into practice, motor vehicle crashes are one of the leading causes of deaths among kids in Colorado. And that we used kind of regular hard data. And we also heard from community members that they were concerned about car accidents in their neighborhoods and around, like in the communities around the hospital. And so we took that and brought up-to-date legislation to require improved standards for car seat installation and recommendations for the state, so that if you're pulled over and your child is not in the most up-to-date car seat, there's education. We stayed away from fines. We don't want to fine people, but there's education, and we provide that on site. So we also have a team doing car seat installations and things like that. So it's kind of a wraparound. And now we also just passed a bill that will require insurance companies, if you're in a car accident, they cover the cost of a new car seat. So connecting the dots there.
Now we're almost done.
Yes.
Time. So really quickly, again, something that you can be advocates for child health is the 2025 election next month. We know that off-year elections are not always seemingly the most exciting, but they're so important for the work that we all do. There are so many. I was just looking when we were sitting at the Arapahoe County sample ballot. There's mayoral positions, there's city council positions, there's local ballot measures to consider, there's school board seats that are up. These are all really powerful positions that have a direct impact on the communities that you work with, and also, as presumably a few of you live in this area as well. So certainly make sure to register to vote or update your registration. You should have already gotten your ballot in the mail if you're updated. Those got mailed out last week, but you can always request another if you didn't have your voter registration updated. Early voting opens on October 27th, as well as the drop boxes. I always recommend to put a mail ballot in a drop box versus actually mailing it, but the choice is yours. Election day is November 4th, so just make sure that you've dropped your ballot by 7 p.m. or you're in line to vote by 7 p.m. to be eligible to be counted. And I'll also send us follow-up. We've got a voter guide that we're happy to share, and it has a little bit more information about the ballot measures that we supported this cycle. There are 2 statewide ones you'll see. Luckily, your blue books only have 2 things in them this year, so they're a quicker read than past years. But Proposition LL and MM and their support for the Healthy School Meals for All program is something that we're happy to support. So certainly we'll share that link to you all. And then also want to share this QR code is for our grassroots network, which is called Child Health Champions. That's where we send out monthly newsletters, updates on child health policy developments. All of our action alerts go through that channel too. So if you're looking for quick, easy ways to get involved in some of the work that we, again, do in partnership with plenty of others, this is a great place to start. And like I mentioned, beyond that, feel free to email either of us to our direct emails or to the advocacy@childrenscolorado.org.
Rest a bunch before.
Thank you.
No, we didn't really have an off season this year. We had a special session, but.
All right, thank you, everybody.
Thank you.
And thank you all for being here. Thank you so much.